Hey there. I wanted to review Maggie's MRI with you. So Maggie is a middle-aged Australian cattle dog that presented to us with this very common presentation of inability to use the back legs. She's out playing, she screams out, and all of a sudden she's paralyzed. The owners brought her into us, and what we could see is that despite the fact that she couldn't move her back legs, she still had good tone or strength in the legs. The segmental reflexes were normal, meaning that her patellar reflex and her ability to pull her feet away from us was normal. And she could feel deep pain perception. In other words, we would pinch her feet with a hemostat and she would turn around and say, hey, don't do that, which suggests some level of spinal cord integrity, which is great. This suggests a problem between the third thoracic and the third lumbar segment, essentially a problem in the middle of the back. There's a bunch of things that can cause that. We think about herniated discs in the spine. We think about spinal cord strokes, and then less commonly, inflammatory diseases of the spinal cord or even tumors of the spinal cord. So here is her MRI. And when we look at an MRI, we first look at the plane of section. So this is a sagittal section going right down the middle of her belly. And so what you could see here is this is the top of her back and this is the bottom of her belly. Her chest would be over here and her tail would be over here. And perhaps another thing to consider is that this is a T2 weighted image. So things that have lots of water in them, like fluids and fats, are going to be bright, and things that don't have a lot of water in them, like air and bone, are going to be dark. So to kind of orient you, here's the fat on her back, here's the muscles on the top of her back, here are the vertebra underneath, and then all her guts in the abdomen. But neurologists don't care about that. Bladder, spleen, intestines, those sorts of things. These little guys here are the vertebral bodies, and in between them are the intervertebral discs. And you'll notice that they're kind of white or gelatinous in the middle, and then black and less water on the outside. The nucleus pulposus on the middle and the annulus fibrosus on the outside. Here's her gray spinal cord going down the middle, and then on each side of the spinal cord is epidural fat and spinal fluid. And your eye immediately gets drawn to this spot here. When you look at that spot, you can see that there's brightness, which suggests water within the spinal cord. And then if you look underneath it, you could see that the disc here is a little bit smaller than adjacent to it. This one's degenerate, of course, but this is an abnormal disc. When we look at the spine and cross-section, what you're going to see on the left is a green line which represents cross-sections of the image on the right. And I apologize for the motion artifact. She was panting a little bit, which is one of the challenges with MRI. If dogs are moving, we can get some artifacts. But I think what's most important is this: top of the back, bottom of the belly, right side, left side, muscles around the spine, vertebra. And if you're looking outside the spine, like a non-neurologist, we got kidney, aorta, vena cava. But look right here. Here's the spinal cord in the middle. It's gray, but it has this kind of wedge-shaped white area suggestive of inflammation. Now, most veterinarians, you say wedge shape, thinking about something like a kidney, and they know it's a vascular event or stroke to the spinal cord. This is very similar in dogs, and this is kind of what we're seeing here in the spine, So what can do this? This is a real interesting conundrum when it comes to the veterinary space because we see two conditions that look very similar. One of them is known as an FCE, also known as a fibrocartilaginous embolus. That's a period of time when the blood flow is occluded to the spinal cord or blocked to the spinal cord by a piece of cartilage. The other condition, which this looks a little bit more like, despite the fact that both look similar, is what's known as an ANNPE, also known as an acute nucleus pulposus acute non-compressive nucleus pulposus extrusion. That's a bit of a tongue twister. And basically what that means is that at some point when she was out playing, these two vertebrae came together and caused the disc to bang into the spinal cord, causing a big contusion, but then it dissipates away. So what we're seeing is the bruise in the absence of the ongoing compression like we see in other more traditional discs. The good news about these conditions, especially given Maggie's presentation, is they can make excellent recoveries and they don't require surgery. So I think it's a great reminder that MRI can give us diagnoses that don't always lead to surgery, and dogs can have excellent outcome with supportive care, meaning things like water treadmill and physiotherapy. And Maggie did great. Owners were happy, and we're really excited to see Maggie going back to normal.